Well, hello. This is episode 4 now of Ethics Today, and our guest this evening is Robert Schreur, who's a clinical supervisor in Johns Hopkins Health System. I believe you work at the Johns Hopkins Bayview Medical Center. Is that right?
Yes. Yeah.
And you are also a practicing psychotherapist. So you have your own clients in addition to working as a supervisor for others who are themselves working for clients.
Yes.
And I wanted to talk to you. What we're doing with this series is I'm interviewing a number of professionals in different areas of life because it seems to me that we're facing as a society some of the most momentous ethical choices that we've ever faced. I think it certainly in my memory, we're facing these individually, like how do we respond to the requirements for social distancing? How do we, adjust norms of etiquette? When somebody wants to shake hand and we think, well, we're not doing that, and how do you deal with that? So minor things, but also major things, and affecting the common good. So one of the first discussions we had was about ventilator allocation and how do we make decisions about how do we share very scarce resources and make decisions about who gets life-saving devices. And what I wanted to talk to you about tonight is this idea of mental health, because I'm hearing so much about the real or potential mental health effects of this pandemic, and some, I think, from the pandemic, the fear of the illness itself, but also the effects of social distancing and what both the short-term and long-term effects that might be. And you're in a kind of unique position because you're both seeing clients yourselves as a psychotherapist, but then you're dealing with patients in a health system who have different kinds of needs. So could you just describe for us, like, who are some of the patients you deal with, and what are they facing right now?
Yeah, it's interesting. So let me start just briefly with my private practice. For 4 weeks now, I've done only telemedicine therapy, either with Zoom or just by telephone. And it's interesting, the individuals I see there have a whole range of reactions, from really liking it, not having to bother with dealing with people out in society, not having to deal with, there's no sports on TV, is one of the comments one of my clients always says that he likes a lot, and he has more time to do his own things. Others feel really grateful that they're in a position where they can handle it. They feel like maybe a few years ago they couldn't. Some are frustrated at it and think it's, just government overreaction, and are really kind of perturbed at it. I have yet to, either in my private practice or with the hospital, have any clients who've been infected with the virus.
Okay.
No colleagues either, just sort of remarkable at this point.
And in Baltimore, there are a lot of cases in Baltimore right now, isn't that right?
Yeah, there are. And so Hopkins Hospital, particularly Bayview Hospital where I work, has a lot of dedicated units. It's put up tents outside to do triage and, protect the airflow and so on of treating patients. And it has a significant number, but not as, I think we're prepared for more. And hopefully we won't get there. But personally, only at a remove of maybe 3, the parent of a patient I work with was diagnosed and did die, either from complications from coronavirus or other complications. But out of dealing with almost, I'd say, directly with 80 and indirectly with over 200 patients that I'm familiar with, none of them have been diagnosed positive.
So, in the range of reactions that you talked about are pretty much similar to what anybody might experience. I mean,
Yes.
a lot of us are finding, a return to maybe more meaningful activities or new ways of connecting with family, but also a
Yeah.
loss of many of our favorite things that we enjoy doing.
Yeah.
And but what about the long-term effects of this? If this
Right.
goes on, some form of social distancing, and kind of the threat of pandemic, and we're talking about maybe we'll have surges where it becomes episodic. Do you think that you're going to see more serious problems as a result of that?
I imagine so. Yeah. I didn't really speak about the patients that I'm responsible for at the hospital, and that's a different cohort of individuals. So at the hospital, I work with patients directly on my team. 60 patients are assigned on my team to be cared for by 8 caseworkers and myself, plus psychiatrist and nurse and so on. So those patients, we call them members in our program, are diagnosed with severe chronic psychiatric illnesses. So they suffer from schizophrenia or bipolar disorder with psychotic features. So they, tend to live fairly marginal lives and struggle profoundly with mental illness, hallucinations, hearing voices, profound delusions, disorganizations, disorganizational behavior and thought. Typically, the patients we see have been institutionalized in state psychiatric hospitals, and kind of the rationale of my particular program is to keep them out of state hospitals and functioning in the community, which we do a really great job of. Functioning in the community looks like, not wandering the streets. It looks like staying in a group home and taking medications. But that life tends to be far better than being institutionalized. Those patients have responded in an interesting way so far to the crisis. Their lives have been, even more turned upside down. Many of them would have come to our program a few days a week and socialized and, been involved in the community. Some have jobs. All of that is basically lost to them, and they're quarantined at home. And yet there haven't been, for the most part, severe reactions to that. There hasn't been, defiance of the orders or psychotic breaks or acting out in severe self-injurious or threatening, dangerous behavior to others, which kind of surprises me. I think that could change over time, as you suggested, but right now there's almost I think there's some truth to it. It sounds a bit like a facetious joke, but it's as though their world is now our world.
Mm.
You know, many of them would live with a fear of being infected by others, and now we all have that fear. They might not know social cues, like you said, about when to shake hands, and when people are too close or too far. Now we're all living that way with sort of invisible forces that are controlling us that we can't really see, and government, restrictions. So members that I work with might believe they work for the NSA or the CIA and are being told what to do. Well, we're kind of being told what to do. So in a way, this is the normal for them. It's not all that unusual. And maybe there's some comfort in seeing now everybody gets it. This is the world I've lived with.
Yeah.
So
Well,
I think there's some truth to that.
and the studies that were done after the London bombing blitz in World War II were kind of, there was that expectation that there would be much higher incidences of depression and suicide, and other kinds of mental health breaks. And in fact, all of those statistics went down during that time. And the kind of the thought is, well, in response to these crises, people come together. We find kind of a meaning in our common struggle. And I wonder if there's some of that effect as well.
Only to the extent that there might be a sense of commonality.
Okay.
I don't think for the patients I've been talking about, they're really, they live in their own worlds more or less. And so there isn't a lot of, you know, of course they enjoy each other, everyone's company to some extent, but maybe now they aren't being required to act like they enjoy it. Social isolation is something they're familiar with, and even something that's maybe required of them because of their diagnoses or their experience of life. So
the very thing that many of us are maybe missing at this time, this social connection, is something that they experience as a burden. Some of your members anyway.
Yes, that's right. Some do, and others, the social connection they are getting, being able to sit at home and watch TV with some other people, is sufficient for them, whereas it's might drive you or me stir crazy. For them, it is nourishing in a socially affirming way, and they aren't being asked to do more. I think that's true, at least of a significant number of the patients I work with.
Well, so in your own practice, and also with those that you're supervising, other people that are working directly with these members, do you feel like you're able to be as effective? I mean, you said some of your clients actually have enjoyed meeting by Zoom or telephone.
Yeah.
But how does, like, your understanding of what they're going through, is it as effective when you can't see them in person? Isn't there a lot of like nuanced observation that you have to make as a therapist?
You would think so, and no doubt it's true. One client said to me, well, this is like psychoanalysis. I'm sitting behind them on a couch. I'm not, engaged in eye contact. We aren't communicating that way. It's only words and silences and pauses, and that is interesting to me. I'm not a practicing analyst, but in my private practice, certainly I do psychoanalytically informed psychotherapy. And so it just almost requires a deeper kind of attentiveness, which I sort of enjoy, about listening to just the words and not maybe having less input in terms of other forms of communication, facial gestures and so on, really maybe allows us to go a little deeper, or allows the client to not have to worry about me and interpret my reactions. And because I've only done this, for over a month or a month and a half, there's a long history with my clients of direct face-to-face communication. So they have a good sense of what it is like to talk to me, of who I am and I of them. So this almost, I think, can deepen the connection for a little while. I don't know how long that'll last, but I'm kind of appreciating that. And it's a new challenge that's sort of interesting to me. And you asked about the effect on the clients, so that seems positive, and so far, I think, to them.
Right. So, and you mentioned this deeper kind of attentiveness that you have to pay. And when we talked for just a few minutes before we started recording here, and I asked you how you were doing, the first thing you told me was you're exhausted.
Yes.
And and so I would imagine that goes for the people that you're supervising as well, that there's there's a greater kind of attentiveness you have to pay when you're doing things on screen. And then of course you're an administrator, so you've got a lot of meetings and so forth. So what's changed, I guess, in your work over the last month to 6 weeks that you've been doing things this way?
Yeah. Although I spoke of the potential benefits to the clients in my private practice and sort of the potential psychotherapeutic benefit of this new modality, it is exhausting for me personally. I think I get a lot out of one-on-one human contact. After I work a day at Hopkins and then do my private practice, I was very rarely exhausted coming home, or I maybe was physically tired, but I had just spent some quality hours talking to people about interesting things that they are, deeply invested in their own lives, and that energized me. And just being in their presence, I guess, energized me. And I find that doing telemedicine doesn't have that effect. Almost like we say goodbye and I'm weary. And that was not the case when I met with them in my office.
Right.
So in terms of private practice, for me at least, there's a kind of exhaustion that comes with it. And I think for my staff who are caseworkers for their clients maybe would report similar things. They enjoyed spending time with these people, going out in the community or having them sit at their desks or talk to them in an appointment or whatever. There's a lot of emotional feedback that's uplifting, and that's why they got into this field. And now just to make phone calls, you don't get the same enriching experience back.
Right, and there's a kind of weariness that comes from doing this work over and over from the very same location, the same physical location, right? And
yes.
You're oriented to a screen in the same way that, like, for every single person, I would imagine that after a while, it just becomes harder to pay attention to what people are saying, and you've got to push yourself harder to do that.
Yeah. Yes, definitely.
So as a supervisor, how are you working with your team? How are you keeping their energy up? I'm just curious what challenges you're facing as an administrator in this situation.
Yes. We do Zoom twice a day, sort of a morning huddle that tends to be fairly short, just talking about what we're expecting to happen in the day. Right now, of the 8 people on my team, 3 come to the location, and 5 work remotely from their homes. I think it's their homes, maybe it's their cars. I don't know where they're working from, but remotely. No, but working from home. So we have a morning huddle where we talk about what's expected, and then each afternoon we do rounds. Prior to COVID-19, we did rounds just 3 times a week, and sometimes I would decide not to do them. And rounds consist of going over all 60 members and talking about issues, concerns, keeping up with appointments, if there are any telephone appointment or telemedicine appointments now. And then, so the team, I admire deeply each of them, and they're all really committed in their own ways to this work. And it's a really high functioning team, has been. They have each other's backs, they enjoy each other. somebody needs help, instantly other people are offering to do it. I worked with them for about 3.5 years now and really got lucky to have taken on a high functioning team. My job was just not to ruin that. And, but it's fraying. They enjoy each other's company and now they're not sharing it. I'm sure they chat and they talk and we meet twice a day, but they really enjoyed just each other's company, and that's not happening anymore. And so and there's not that camaraderie. Of course, they'll help each other, but it's not the same at all. And there's less to help with. We're calling our patients to see how they're doing, and anybody can do that, but they can do it for each other, but it's not the same as saying, I'm driving over to this area of town. Does anybody need me to check on anybody?
Right.
That's not happening.
So are you worried about what happens over the long term as you go on? We've been doing this for a few weeks now, and you're seeing that's the kind of the support or the connection for one another seems to be fraying a bit with this team. Is this?
It is, yeah.
Yeah. And what we know is, like, from reports of burnout, it's really high in the medical professions, especially with nurses, but also social workers. Teachers also have a pretty high burnout rate, especially like over about a 5-year period. It's pretty high. And there's a number of things we can do, but we know that one of the really important things is the friendship is so incredibly important, and the time that people get to spend with one another, either developing friendships at work or after work. And it's just much harder to maintain those friendships, right, when you're not able to see one another and interact directly.
Yes, yeah, very much so, yeah. And there's certain staff on my team that I can see it's taking the toll already. They're less involved in our meetings. Certainly they're still doing their work and doing it well, but there isn't that enthusiasm. There's a kind of weariness, and I know some are facing issues at their homes. Working from home with kids around is very challenging.
Yeah. So how about yourself? How are you keeping your energy up? I know you have a number of 12-hour days that you're spending when you're at Johns Hopkins, but then you've got clients in the evening that you see your own.
Yes.
How are you managing to keep your own energy up?
I'm not sure. I'm exhausted at the end of the day, and I sleep. My sleep hasn't been as good. I usually have been a good sleeper, and now I'm waking up and finding myself thinking about work.
Yeah.
Which is sort of new for me, to be that consumed with it. And the things that have sustained me in the past are a bit taken from me. So walking in nature is not as easy to do. We're not, parks are closed.
Mm-hmm.
Ride my motorcycle, but that's not exactly essential transportation. I can say I'm, in fact, I will ride it to work one day a week and make sure I have my ID and a letter from work saying I'm essential personnel, not that state troopers seem to be pulling people over at this point to ask. But that's a joy, and on weekends, I'm not really going out for rides. Not going out to restaurants, which is always a pleasure.
So for many of us, we lose some of these activities, and it's an inconvenience. But I would guess that if you're somebody whose very job is to listen attentively to other people's struggles, and you take them into yourself. You have to if you're really paying attention. The kinds of relief that you get from these other activities become almost essential to doing the job.
That's how I justified the motorcycle.
So,
not enough to make it a tax write-off, sadly, but
oh, okay. Well, we'll see.
yeah.
Well,
But yes,
this has been a fascinating discussion because I was expecting to hear more about the real difficulties you had with telehealth, but really it's more the difficulties of managing yourself and your team is the main struggle here. And I'd be very interested to come back and talk to you in a couple months and see how you're doing then.
that'd be great, Rick. Thank you.
Okay, good to talk to you. Take care.
All right, you too.
Bye.
Bye-bye.